Ladies and gentlemen, let's call the meeting to order. I'd like to introduce next speaker, Professor Yang Hong. He's from the first affiliated hospital, Guangxi Medical University, Nanning, Republic of China. She's the Director Department of Medical Ultrasound. Let's look forward to Professor Yang's inspiring speech. Thank you.
Thank you very much. Good afternoon, everyone. It's my pleasure to be here. I'm Dr. Hong Yang from the Medical Ultrasound Department, the first affiliated hospital of Guangxi University. Unlike other countries, medical ultrasound is separate from radiology in China. So we perform the ultrasound scanning, diagnosis, and interventional ultrasound in ultrasound session. So today, I would like to share with you the microwave ablation for thyroid nodules and discuss the value of CUS in the whole procedure. In this presentation, I will begin with the introduction into the prevalence of thyroid nodules, and then I will discuss thermal ablation for thyroid nodules. And after that, I would like to share with you our experience for the CUS application during the microwave ablation. And finally, I will wrap it up with a brief conclusion. According to the statistics report, thyroid nodules is the second highest incidence rate of thyroid disorder in China, close to 14%. And as we all know, among the thyroid nodules, only about 5 to 15% were malignant, and most thyroid nodules are benign. And around most of these benign thyroid nodules do not require treatment, but there are still some certain conditions that require medical intervention, such as cosmetic problem caused by anterior neck swelling. Thyroid nodules are too large to compress the surrounding tissues and organs. A patient of mine can only on a liquid diet because the compression is so hard to block the esophagus, and so he can swallow other stable food and only can on the liquid diet only can swallow the liquids. And besides the traditional surgical resection, there are some additional treatments which do not need surgery, which include radioiodine ablation, chemoablation, thermal ablation, anti-ablation, and irreversible electroporation. Okay, now I would like to talk about the thermal ablation treatment for thyroid nodules. Among the additional treatment we talk about, thermal ablation is a very popular treatment in recent years, which include radiofrequency ablation, laser ablation, microwave ablation, and high-intensity focused ultrasound. According to the guidelines set by AACE, ACE, AME, image guide thermal ablation for benign thyroid nodules may effectively control nodule growth and local symptoms, which is recommended for the treatment of solid or compressed thyroid nodules. There are also other guidelines set by other countries, such as South Korea, Austria, as well as China. Among the several thermal ablation techniques, microwave ablation is the most frequently used technique in China, and the mechanism of microwave ablation is similar with the radio frequency ablation and the laser ablation. Now, I would like to show you the procedure of microwave ablation for thyroid nodules. And to begin, we insert the needle into the bottom of the thyroid nodule. And then the microwave ablation release and from the tips and made the molecular around this vibrate and increase the temperature and then burn the tissues. At the same time, a cold water circulation system is equipped in the machine, cook the needle and avoid burning the surrounding tissues, and which will avoid the complication and such like burns our skin and muscles of the nerves or the vascular vessels. Unlike ablation performed in other organs, such as liver, renal, or lung, a movement ablation method is used for thyroid nodules, especially for benign nodules. As this video shows, during the process, we insert the QT needle antenna in the bottom of the nodule. After nucleosis happens, we move the needle to a new area, and then from the point to point, we got an ablative line, and from line to line, and then we got an ablative section. You can see from point to point, and then we got a line, and from line to line, and then we got a section. And by this way, we got another additional overlap ablative sessions until the whole nodule nucleosis is completed. There are potential risks that exist in this procedure. And due to there are several important structures around thyroid, including large vessels, arterial and vein, and nerves, and throat and esophagus, and which could be damaged during the operation and cause very bad results. To reduce the risk of this procedure, first of all, we do not ablate in the dangerous angle, which locates here. Also, we can inject 5% glucose or satellite to major isolation area, and which will separate the thyroid and the nodule from the surrounding tissue, especially the very important tissue and organs, to avoid the burning. Okay, for the next part, I would like to share our experience about the application of contrast-enhanced ultrasound in the whole procedure of microwave ablation treatment of thyroid nodules. With the second generation contrast-enhanced agents and harmonic techniques, contrast-enhanced ultrasound has overcome the limitation of conventional ultrasound and show the microcirculation of tissues and tumors. and which play an important role in ultrasound diagnosis and interventional ultrasound. And from the right picture, we can see the second generation contrast enhanced agent microbubbles have the similar diameter with the red cells in our blood, and which can trace the movement of our red cells and endure the acoustic pressure which produced by the probe, and then make the real-time contrast enhanced image realized. And according to the guidelines I mentioned above, contrast enhanced ultrasound is recommended to be used in the whole procedure of thermal ablation for thyroid nodules. In our hospital, we use CUS to evaluate the thyroid nodules before and during and after the ablation procedure. First, before ablation, we use CUS to make a diagnosis and evaluate the vascularity of the target nodules. According to the data from our hospital, combined with conventional ultrasound and CUS, diagnostic efficacy of thyroid nodules increased more than 50%, and sensitivity, specificity, and accuracy. Second, during the process of ablation, we use CUS to evaluate the efficacy of ablation right after the process has finished and guide the supplementary ablation if it's needed. Thyroid is a hypervascular organ, and bleeding sometimes during the ablation procedure. When bleeding happens, CUS can be used to find the bleeding area and guide to stop the bleeding. Third, after ablation, we use CUS to evaluate the efficacy of ablation and the recurrence of ablative nodules. This case was a 46-year-old female with a thyroid nodule located in the labrum. The maximum diameter of nodule was 3.4 centimeters. Cytological examination results demonstrate nodular goiter. There is not any suspected malignant characteristics shown on the conventional ultrasound, so we categorize as Type 3 nodule. And then we perform CUS. We can see majority of nodules show iso enhancement, and with several non-enhancement areas in the nodule. And a ring line happen hyper-enhancement around the nodule, which is a typical benign characteristic of thyroid nodules. And during the biopsy, we need to avoid to biopsy the enhancement area. During the ablation treatment, a couple of minutes after ablation, and gas will disappear. And then CUS performed to evaluate the efficacy of ablation, and necrosis and a live tumor could be distinguished easier on CUS but not on the US. Just like this picture shows, hyper-enhancement means there still have the blood supply as no necrosis. And then we made a supplementary ablation guided by the CUS until no enhancement shown in the nodules. And then 1 month later, CUS was performed again to evaluate the blood supply of the ablative nodule. And the two below pictures show there is no enhancement in the total whole nodules. And this data is from our department in our hospital in 2019. We can see we performed close to 700 CUS cases and about more than 400 cases microarray ablation, and of course it's all data. Actually, in the last year, 2023, we performed the CUS in a total. It's more than 10,000 cases. And for the CUS in the total. And also microwave ablation for all the organ and tissues is more than 1,000. We got very pretty successful in the microwave ablation and also contrast enhanced CUS. So let's wrap it up with a conclusion. According to the evidence I mentioned above, I think microwave ablation is a useful choice for patients with benign thyroid nodules, especially with the patient who do not want to surgery resection and want to have a higher require of the outlook. And contrast enhanced ultrasound is an excellent modality to evaluate microwave ablation for thyroid nodules. However, the microwave ablation for thyroid nodule is popular in recent years. So we still need long-term follow-up to observe the efficacy of this method. And thank you for your listening.
Thank you. Professor Yang's research points out the value of CEUS in microwave ablation thyroid nodules as an auxiliary means of microwave ablation for thyroid nodules. CEUS can effectively evaluate the therapy effort for patients with beginning thyroid nodules, but long-term follow-up is still need to determine its efficacy. Thank you. Thanks again.